receive credit for the session. We also want you to have your real name first and last listed on your picture. So the way you change that is you hover over your picture, you'll see the word mute and then the 3 dots. Click the 3 dots and then select rename to change your name to both first and last so we can give you credit for the session. And remember that we do take attendance at the end of the session, so you're going to want to stay on to receive credit. Our speaker tonight will be taking questions at the end of the session, so if you want to write your questions down, when it's question time, she'll announce that. We'll take questions at the end rather than throughout the session. So I'm so pleased to be with you tonight and to have the chance to introduce our guest speaker, Anna Timmons de Gregory. Anna has over 20 years of experience working with children diagnosed with autism spectrum disorders. She holds a master's degree from Rutgers University in elementary education and special education, as well as being a board-certified behavior analyst. Sorry, my brain couldn't do it. Analyst. Anna has worked in a variety of roles and settings, including director of the Manhattan Children's Center and supervisor of the Manhattan Behavioral Center. Anna currently works with the Data Group, designing activities and treatments in autism, and is a BCBA supervisor for the New York Behavioral Analysis and Psychological Services. Anna loves to travel and has visited over 20 countries, including Kenya and Ecuador, where she volunteered with the Global Autism Project. We're very excited to have Anna here tonight to share her expertise on autism and behavioral interventions. Please join me in welcoming Anna Timmons de Gregory.
Hi, everyone. Thank you for coming. That was a very nice intro. I am lucky enough to also have a friend and colleague with me. Her name is Natasha Dickus. She will also be presenting. Natasha and I actually went to Bali together with the Global Autism Project. So that's kind of how we know each other. She is a resident of New Jersey. However, she is a longtime native of Nebraska, where she obtained her Master's of Arts in Educational Psychology and Applied Behavior Analysis from the University of Nebraska at Omaha. Natasha is also a board-certified behavior analyst with over 14 years of experience working with individuals with autism, ranging from ages 2 all the way to 50. She's worked in various settings, serving as lead case manager, behavior specialist, staff training coordinator, BCBA supervisor, and independent consultant. She's currently an adjunct professor for Capella University and an organizational development manager at a cafe that employs individuals with autism and/or other abilities. Outside of work, Natasha is an avid traveler and coffee lover, visiting over 150 different coffee shops. I did not know that. She also enjoys volunteering for companies that employ individuals with disabilities. So welcome, Natasha.
Thank you.
Okay, so we're going to get started. Share my screen. We're doing the A-B question, correct? Okay. So we have a plethora of information. We have so much information to share with everyone, and we want to make sure that we can give you all the information that you're interested in learning about. So we're going to take a short poll where you can let us know if A, you would like to learn more about autism spectrum disorder and symptoms, or if B, your priority is learning about behavior management. So you could put in the chat, A, if it is about autism spectrum disorder and symptoms, or B, if you would like to hear more about behavior management. Take a few seconds and Raquel or Dawn will share that information with us.
So right now it looks like B is the winner.
B, okay. Okay, so we'll spend a little bit less time on ASD, but we'll still touch upon it. Okay, well, let's get started. Natasha.
All right. Well, again, welcome everyone. Like Anna had mentioned, we will be spending some time talking about autism and then going into some behavior management. So Anna, you gotta advance my.
Mhm.
Oh wait, can I do both of them? No, I cannot. All right. So autism spectrum is a disorder. It's also known shorthand as ASD, and it is a lifelong neuro developmental disorder that is characterized by impairments mainly in social communication, and behaviors. So what is ASD? So when we look at ASD, it's kind of, again, they call it a spectrum, and we'll talk about that here in a minute, but it is a developmental disability caused by differences in our brains. So a lot of people with ASD often will have inappropriate behaviors, or they might just behave a little bit differently. They oftentimes communicate a little bit differently. They interact socially a little bit differently from, what we might consider typical. So when we look at individuals with autism, they don't really look any different. There is no signifying marker similar to someone that might have like Down syndrome or Fragile X syndrome. There's clear facial features with some other disorders, but autism doesn't have like a face. So some potential causes that cause autism, it's varied. There's no one cause. We do know that it is genetic. There's been a lot of research out there that suggests that it is genetics. However, they haven't pinpoint which marker that is like Down syndrome. They know it's that a specific chromosome. Autism, we're not sure. We know it's genetic. We just aren't sure which of the markers there are. And we know there's other known causes. It's just we're not completely sure. There are still some unknowns, which is kind of where we get a lot of controversy because there isn't a clear indicator of what the actual cause is. So you might have heard varying things out there, but we do know that genetics does play the main role. There are also some other causes that, as scientists do the research, that the prevalence is looking at, genetics and our environment and how those two play and intervene on each other. So again, we still have a lot to learn, and how not only do our genetics and our environment impact individuals that are diagnosed with ASD. So there are some early markers. So when we look at individuals that are diagnosed, or maybe we think that someone might have autism, usually those markers do present themselves before the age of 3, and it is a lifelong trajectory. As they get intervention, which we'll talk about some of that, or have behavior management strategies, some of those behaviors and communication like increase. So we do see, maybe some symptoms subside, but it is a lifelong diagnosis. Usually, symptoms do appear within the first 12 months of life. So we're going to start seeing some of those early symptoms of maybe lack of eye contact, pointing, things like that, social awareness, joy, and attention. So that usually occurs within the first 12 months. However, there are some other symptoms such as more social interaction, more complex social interaction that might not appear till 24 months or even longer, depending kind of on the individual's upbringing. So to jump into prevalence, the new statistics that are out from the CDC and maybe like Autism Speaks, but mainly the CDC is where we pull our information. that 1 in 36 children are affected with autism spectrum disorder. So that has increased, and it usually increases every year. So it is a big number. ASD is reported to occur in all racial, ethnic, and socioeconomic groups. So it isn't biased, it just occurs in every class. And then it's also, I don't know if any of you know this, it is 4 times more common among males than females. So oftentimes if you do see more males get diagnosed, so that's kind of a little bit more common. And then when an individual, a female, does get diagnosed, oftentimes the characteristics are a little bit different. So they might present a little bit different. So they are usually diagnosed a little bit later in life and not always diagnosed as soon as their male counterparts. So speaking about diagnosis, I'm just going to touch base a little bit, and then Anna's going to talk a little bit more about it. But for diagnostics, there is no medical test to actually diagnose. There isn't like one test. Mainly the test is through observation. And it's a test, it's called an ADOS. There's some other tests that are out there, but it's mainly through trained professionals. I have had the experience of administering that test and being trained in that. And it's a lot of, your subjective opinion with other people's observations. So that's mainly the way that an individual does get diagnosed. It's usually a team of people. It's usually a psychologist, somebody who's running those observations, SLP, maybe a pediatrician. So it's usually a team of people. And we look at what is called the DSM-5, or that's the Diagnostic Statistical Manual of Mental Disorders. So we look kind of at the criteria that are in that manual, and the main criteria that we kind of focus on is that social communication, or that interaction piece, and then restrictive and repetitive behaviors. And I'm going to talk about some of those on the next couple of slides, what those domains look like. So for an individual that has autism, social communication and interactions, there's a whole list, but I only included some of them. So it's usually communication, things like doesn't want to respond to his or her name. They might have trouble making like eye contact. They might use few or limited gestures. So they might not wave goodbye, or they might not like do like a distal point. They might have like a flat affect. They don't really show facial expressions, or being able to label facial expressions on another individual. Like, so, maybe it's like, how does mommy feel? And they're not able to identify that mommy feels sad or happy. So looking at some of those, they might also avoid like eye contact and not really showing interest in other individuals. So they really kind of want to have that more of that solo play, and they're just not very interested in that group dynamic. And then the other category is restrictive or repetitive behaviors of interest. So at some point, we all young individuals, as you go through development, have these types of behaviors. It's at what point do these kind of subside and turn into more socially appropriate behaviors? So individuals on the spectrum have this rigidity that they can't get past that point of, oh, it's no longer socially appropriate, or mitigating and turning it into some other behavior. So some of the things that are associated with this are like lining up objects and getting upset when that order is changed, repeating words or phrases, and having changes in their routine. So having to take the same path to go to school every day. And if we go left instead of right, it becomes maybe like a tantrum, or we see some behaviors because of that change. Let's see, like flapping hands or body rocking, spinning in circles, or actually spinning other objects might be another one of those behaviors. And then just sensory, like sensory overload with maybe a sound, smell, touch, or taste. So those are the two main categories to be diagnosed with ASD. So there are some other characteristics. I'm not going to read the whole slide, but there are a lot of other characteristics. Someone with autism might actually also have a comorbid diagnosis of something else. They could be ADHD, they could have depression, they could have OCD, oppositional defiant disorder. There's other comorbid diagnoses that they could have, as well as maybe delayed movement skills. Like I said, maybe depression, so they have unusual mood or emotional reactions, anxiety. All of those things could also be characteristics of autism, which is, again, sometimes why autism is hard to diagnose, because it has other symptoms of other individuals or other disorders. So when we say autism spectrum, we really want to think that in the old diagnostic criteria, there was, they had different measurements, but we're looking at it not being so much as a linear, like it's not a straight line. It is more of a circle. And it's it has different pieces of that pie. So it might not all be full, and it might be splintered off, and it's more circular than it is linear. So we don't really want to use like high functioning or low functioning. It's just more of, here's the spectrum, and this is kind of how they present in these different domains of like social skills, routines, stimming, those types of things. So I don't know if any of you have heard of this saying. This is a pretty common saying in the field, or if you work with individuals with ASD, that if you've met one person on the autism spectrum, you've really met one person on the spectrum. Having that firsthand experience working with individuals with ASD and other disabilities, just in general, you really are just meeting that one individual, because they're all individualized and have different skill sets and different, what we would call as splinter skills. So they're all different, making it that big spectrum. So that brings me kind of to wrap up this autism. When we think about autism, thinking about acceptance, I don't know how many of you are familiar with the puzzle piece. Can I get a show of hands, or yeses or nos if you're familiar? Yeah, so got some hands. If you're familiar with the puzzle piece. So that was a big piece of autism awareness and acceptance. And recently, we're kind of shifting away from that puzzle piece. Individuals in the autistic community, they felt that it like pigeonholed them and put the pieces, like having to put something together and piece it together, when in all actuality, there is nothing to fix. They believe that this is who we are, and that this is us. Within the last couple of years, the infinity sign is a symbol of autism. It's actually more of a symbol of neurodiversity, which encompasses autism. Neurodiversity is more of the mental, like ADHD, anything that you can't see, that's more of that cognitive functioning. So we now use the ribbon, like the infinity sign. So it basically represents that there's nothing missing. There is no piece or puzzle, like that piece that needs to fit in. It is just that we're on this continuous journey to keep growing and figuring out that cognitive growth and that acceptance and that commitment. So if you see the infinity sign, it will be coming in April, because April is Autism Awareness Month. So that you'll still see the puzzle piece, but as awareness shifts, we're shifting to that new infinity sign.
Thanks, Natasha. Oh, hold on. So Because everyone's really interested in knowing more about handling challenging behaviors, we are going to move a little faster through the next few sections. We thought it was really important, though, that everybody gain a pretty comprehensive understanding in as short amount of time as we had to learn just what autism is. And like Natasha says, when you meet one person with autism, you've only met one person. So all of the symptoms that she went over, that doesn't necessarily mean every single individual with autism is going to have one of those symptoms. Not every child won't be able to identify facial expressions. Some may spin toys. So it's really highly individualized. This is just a quick graphic, and everybody's going to be getting the slides of what development looks like. Like Natasha said, autism can be identified at a very young age. And then typically it's diagnosed at least by age 5 for boys. So this is just a, like I said, a visual to give you a sense of developmental milestones. These are the things that children, as they grow, um, typically develop at this age. So for example, at 6 months, takes turns making sounds with you. So if you say, ooh, ah, they say it back to you. Might happen at 5 months, might happen at 7 months. But it's just a good resource to have if you have a younger child and you want to know, are they developing along the timeline that has been identified by pediatricians? So Natasha mentioned the CDC, the Center for Disease Control. They have an app. It's called the Milestone Tracker app, and you can find it on the Apple Store and the Google Play. What you do is you download it, you create a profile, you put your child's name in it, and then you start to answer some questions about their development. So for example, they will say, notices when others are upset or hurt or upset, like pausing or looking sad when someone's crying. So exactly the example Natasha brought up, you would click yes, not yet, or not sure. Another example is points to things in a book when you ask, like, where's the bear? The thing that I really like about this app is that they give you pictures so you know what you're looking at. They also, in this example, give you a video because sometimes you might read one of the skills and you might not know what that looks like. So.
Show me the rabbit again. Where's the rabbit? Good job. Good job.
So it's a really useful tool. I was exploring through it, and I think if you have young children, it would be great to download. They also give some parenting tips for users. You can ask them to remind you of a tip. You can make a tip your favorite tip. It's just more ways to learn how to interact with your children and to monitor their progress. You can also select your own language. Unfortunately, it's only English and Spanish right now, but I could see that expanding. And then the last item is just what we call the MCHAT-R. It is a checklist. Basically, it's just a tool that screens a child for autism. It's a series of 20 questions that you would answer. It's really intended for toddlers between 16 and 30 months. And it's something that you can fill out on your own. And we'll attach this to the resources that we send. And the good thing about the tool is that after you fill it out, if you have any concerns, when you go to your child's next doctor's appointment, you can bring this with you and share it with your doctor. And then you and your doctor can explore, is this something that we need to be concerned about? Is it something we need to just wait and see? And you can figure out next steps. Also, and I'll put this in the link too, you can also fill out what's called the MCHAT online. So I can give you a printed copy, but you can also do it online. Natasha mentioned the organization Autism Speaks. It is a nationwide organization whose mission is to inform individuals about what ASD is. giving them information from diagnosis to getting treatment, and also a place to get help and information. So if everything is not in this presentation, which it wouldn't be, you can always go to Autism Speaks and you can put in your state, Colorado, and information will come up about autism and services in your state. This is just an example of the MChat printed. And then the last thing that I will also add to the resources is they have something called First Concerns, but they called it First Steps Roadmap. So it will talk about knowing what the signs are all the way to going to the doctor and potentially getting a diagnosis. It's really nice because it's just step-by-step explanations.
All right, so Anna just kind of talked about individual development and kind of, you know, if you do see some markers and filling out the MChat and getting that taken care of for that pre-screening. So once, you know, you feel that you have a diagnosis, do know that there are intervention services. And these services are provided, early intervention are provided from birth to 36 months. Anyone can refer the child. There is no cost to evaluation. Here is a 1-800 number. Again, you'll have access to all the slides, and there's an email. And then at the end, we also have some links as well. But there are, I'm going to quickly talk about insurance, because you can get intervention through insurance as well.
I also just wanted to add that early intervention services, insurance, Medicaid, they can also be an avenue for getting a diagnosis. You don't necessarily have to go to them with a diagnosis. It will be a service that's provided to you. So just quickly about insurance, go ahead, Natasha.
Yeah, so just quickly, so again, you can seek out your insurance. In 2010, there was a law that was enacted requiring meaningful coverage for autism. So that is state regulated by insurance plans. So there's a plethora of things that are covered via your insurance. Like Anna said, you can seek out diagnosis, like if you want a diagnosis, behavior training, behavior management, pharmacy care, psychiatric care, psychological care. So a lot of services are covered, thanks to, you know, some laws that were changed in 2010. So there are services out there via your insurance.
Yeah, and to just quickly go through the next slide, this is if you have private insurance through your employer. The same services are provided through Medicaid as well. So that is an avenue that you can go down should you need it.
All right. So if your child does receive that actual diagnosis, you're probably going to have services in home, maybe in a center, maybe in a private school, in the community, in a public school, group homes, workplace. So treatment locations can vary across different settings. However, with regard to school, just again, this is just a quick overview. I don't know how many of you are familiar with IDA, but there are specific laws in place for individuals with disabilities, and that is IDA, and there is a law called FAPE, so it's free appropriate public education, just meaning that individuals with disabilities still have the right to, like anybody else, to have a free appropriate education. So if there isn't a school in their district, or the parents believe that the school isn't providing the services that their child needs, the parents can fight for, you know, those needs to be met because their child is entitled. It is the law. So just kind of thinking about that. In Colorado, the Department of Education should be working with you to provide those needed services. So we do know, as clinicians and just being in the field, that there is a plethora of research that shows that early intervention. So I briefly mentioned ages like what, 2 to 36 months, that early intervention leads to that positive outcome. So early intervention can be up to 10-ish. So thinking about the earlier you get that intervention, the more positive outcomes that individuals will have. So there are different types of treatments. Both Anna and myself are BCBAs, and we provide applied behavior analysis. Both of us have our degrees in that. So ABA is the science, that is what we do. However, there's different vehicles at which we provide that science. So there's different treatments under ABA, like early start Denver model, pivotal response treatment, relational development intervention. So RDI, teach, and verbal behavior. There's a few more out there that are under ABA, but those are just a few. There's some other treatments that aren't, that don't fall into ABA necessarily, but they are treatments that have been effective or shown to be effective. So floor time, and then occupational therapy and speech therapy. So what is ABA? So applied behavior analysis, or ABA, like I mentioned already, it is a scientific approach. We have used principles of behaviorism to guide us, and the previous literature to look at the data and make individualized treatment decisions. So the purpose of ABA is really for us as clinicians to understand and improve behavior. And that could be inappropriate behavior. It can be to improve appropriate acquisition skills. So we want to look at all types of behavior to make more of that meaningful improvement in that individual's life, so that they are able to sit in a classroom, that they are able to have more social skills and go out and have pizza with their friends, or hold a job at a cafe, whatever it might be. So we're looking for that socially significant change. So there's different methods that we can use in ABA. So all those methods are based, again, on that research. They're all empirical, and we're looking at ways that we can constantly modify and improve on our findings, and what might be effective for one individual on the spectrum might not be effective for another individual. So our treatments are highly individualized based on that learner and their needs. And so we also know that skills need to be broken down, even for neurotypical individuals, thinking about how we can break down skills into smaller components to learn a harder skill. So if we're learning to ride a bicycle, how do we break that down into smaller steps to actually ride that bicycle without training wheels? One thing that sets us apart from a lot of other approaches is that we are kind of data driven. It is a blessing and a curse sometimes, but we do look at the data. We look at the data to make treatment decisions. It's not just pulling something out of the air and being like, oh, the wind blew and I think that worked. It's no, you can see there's a graph on the screen. We're looking at, okay, this is what it looked like before we put in that intervention. Now we put in that intervention and we see that decrease. And now we're going to put in and modify that intervention because we're not happy with that. So we're going to keep intervening until we see the outcomes that we're looking for. So it's really the data that dictate our decisions.
I think we went through what could be a whole like college course in autism and ABA in about 30 minutes. So I think we did a good job, Natasha. If anyone has questions about any of that, you could put the questions in the chat and we can answer them later. Or if you want more information, the resources that we are going to be linking should have more information. But you can also, I'll give Melissa my email address. You can also email us. So how to treat challenging behaviors. So just a quick disclaimer about this next portion. Like I said, everything that we went over could be a whole college course or a whole seminar. What we do as BCBAs, what Natasha and I do, is we implement ABA, Applied Behavior Analysis. To do so, you really need a trained professional that's qualified, so has taken the schooling and passed a board exam, and that person needs to directly oversee the program. The reason I'm saying this is if you are experiencing a lot of challenging behaviors with your child, if your child has ASD, this training doesn't necessarily replace any form of intervention. It does not replace any form of intervention. This training is meant to give you some ideas, and the previous portion that talked about getting services, that's where you would go if you're having really concerning behaviors. But with ABA, the BCBA will customize a program. Everything is going to be based individually on the learner. Um, and yes, like I said, if your child is diagnosed with ASD, it's advised to seek treatment following the steps listed. However, many ABA techniques can be used when preventing or responding to challenging behavior in all children. I used to teach in a inclusion preschool. There were children there that had autism. There were children there that didn't have autism. The techniques that we used were effective for everybody.
All right, so first, kind of for the techniques, we really want to learn about ABC. And again, this is kind of a crash course of what the ABCs are. I teach a whole college class on some of this. So again, we're going to be presenting it, and we have some activities to hopefully help solidify some of these concepts. So our ABC contingency, we're looking at antecedents, behaviors, and consequences.
I want to mention too, Natasha, because you said earlier how there isn't a like a medical test to diagnose autism, and the way that it's diagnosed is through observation. So our treatment is going to also be through observation. We're going to be watching what the child is doing and what's happening in their environment, and that's how we're going to make decisions on how to respond.
And with that, that's where the ABC are ABC contingencies. So the A stands for antecedent. So really what occurs before, it's kind of seen as like a trigger. So what occurs before the behavior? What is triggering that behavior? B stands for behavior, or like the response. So that child's response or the individual's response. And then C is for a consequence. So what occurs after that said behavior and in response to that said behavior. So what was done? What did the teacher do? What did the parent, caregiver? What was done? What did the child themselves do? So that's kind of what ABC, that contingency is.
Yes, and if you're coming to this workshop to learn how to address challenging behaviors, the B, the behavior, is what you're experiencing, what your child is possibly doing. The A and the C are ways that we're going to help you know how to respond.
So we're going to do this as a group, and we're going to put our answers in the chat box. So we're just going to kind of practice. So based on what I said, that the antecedent is something that comes prior to the behavior. I'm going to read these scenarios out loud, and you can go ahead and put what you think is the antecedent in the chat box. And then,
Natasha, why don't we model 1 and 2, and then they
okay.
could put 3 and 4 in the chat
Okay.
box.
So Paul hits Becky after she takes the book he was reading. So Paul hits Becky after she takes the book he was reading. So what was the antecedent here? That Becky takes the book. So she took the book, and then Paul engaged in that behavior. So that's what happened prior to Paul engaging in that said behavior. 2, Maria starts to interrupt her father by screaming while he's talking on the phone. So what's happening here? So Maria starts to interrupt her father by screaming while he's talking on the phone. So prior to her screaming, something happened. He was talking on the phone. So her father was engaging in some other behavior, and she decided to scream, and that was her behavior. All right, so now I see some of you are in the chat, doing them along with me. We're gonna have you do 3 on your own. So I'll read it out loud and you can put it in the chat. Devin throws carrots after her mother puts them on her plate. All right. So I see a few individuals have the behavior. We're looking for the antecedent. So what is before Devin throws carrots? What had happened?
What triggered it? I like that word that you have there with antecedent. What triggered it as well? What happened before? There's a lot of right answers.
Yes, there's a lot of answers. All right, so carrots were being put on the plate. So that is what triggered the behavior of throwing the carrots. All right, so last one. Noah screams when he sees the playground when driving to the doctor's office. So what happened or what triggered the behavior of Noah screaming? All right, seeing a lot.
Answers.
Yep.
Okay.
So seeing the playground. So crash course on antecedents. There you have it. So again, I'm using that word trigger. What triggered the behavior? So what is happening before that actual behavior occurs?
And so,
Go ahead.
sorry, I was going to say Natasha and I, as behavior analysts, might go into a situation and we'll be watching it very, very closely and take a snapshot. And we, with the snapshot, identify what the trigger was, because this is key information for how we might respond in the future.
So when we think about, we talked about antecedents briefly. What are behaviors? So when we think about behaviors, it's any action that can really be counted or timed. So it's that action piece that you really focus on, like that behavior. We want to be clear as behavior analysts. We want to make sure that we call them definitions, making sure that when we look at a behavior, it's very clear and concise so that other individuals, so if Anna and I were doing some observation, I come up with a definition and then she goes and observes after me, that it's very clear that she understands what picking your nose is, or hitting somebody, or washing your hands, whatever it is. We want to make sure it's clear that other individuals are able to count it or collect that data. It's also important when we are talking to other individuals, whether that's your child's therapist, your own spouse, a caretaker, etc. It's important to have that clear and specific, what we call a definition of a behavior, to know that we're describing the same thing and that we're looking at very specific of this is what hitting is. Let's see. Kind of said that already. So yeah, in ABA, anything that a person emits that can be counted or timed is really a behavior. So that's kind of what we're looking at. Anything, again, that going back to that action, anything that we can emit that we can count, by meaning like maybe we're tallying it, maybe we're using a golf clicker, maybe we're using a timer, whatever it is, that's behavior to us in ABA. So things like touching your nose with your finger, I gave hitting, picking your nose, jumping up and down. It doesn't have to be bad. And I kind of mentioned that earlier. I think sometimes we focus on decreasing behavior, but ABA is also increasing behavior as well. So again, behaviors don't always have to be bad. Like the riding your bike example, like that's not necessarily an inappropriate behavior. That's a behavior we want to see more of and to increase. So we're going to do this one in the chat again. So we're going to look at these two little exchanges. And then I want you to put in the chat, is exchange 1 or is exchange 2 more clear? So I can read them out loud while you guys read them. But exchange 1 is mother says, Tom has been disobedient at home. Is he bad during therapy? The teacher says, Tom is usually good, but sometimes he is stubborn. Exchange 2 is mother says, Tom has been hitting me at home. Does he hit during therapy? And the teacher says, no, he hasn't hit me, but he has pulled my hair. So which of these two scenarios might be a little bit more clear in providing a better picture of what that behavior might be? All right, I did see a lot
There are
of
a lot
two.
of answers coming in.
Yep. So great. We want to ensure in ABA that these things are observable and measurable. We could talk more about behavior, but this again is like the crash course. We just want to make sure that it's clear so that other people are understanding what, if you look at the word stubborn real quickly, what is stubborn? That's not very clear. That could mean many things. However, if I see the word hit or pulled hair, then it's clear to me what that behavior is.
And we'll get into this in the next slide. But the differences between like stubborn and hit is objective. You could paint a picture of what hit looks like. I could visualize it in my head, and most of us would probably see similar or close to similar things. Stubborn could mean something different for everybody. So what Natasha was saying, how in ABA is like, we really want to just look at what is happening and leaving any of our own opinions out of it. What you consider stubborn, I might not consider stubborn. So when talking about things, we just want to be as clear and judgment free.
Let's see. So and I mentioned the word definitions a few times because us as behavior analysts, we want to make sure that we are defining that said behavior. So how can we define the terms behaviorally? So again, we talked about, we want to make sure that they're counted or timed, that anyone can walk in and observe. And I mentioned that. So if I'm creating a definition for, I can't think of like hitting, I want to make sure that my definition is objective and not subjective. It's objective enough that when Anna comes in to collect data, that she can take data on that said behavior and knowing what it is. So we're going to do a little practice here. So aggression. So what are some words or actions for
How would
aggression?
you define?
Yeah, how would we define aggression?
So you can throw in the chat anything that you think aggression looks like, or any times that you have seen aggression occurring.
All right, so we got like using force, hitting, yelling, maybe throwing an object, pushing. Hitting and pushing is a lot. I'm seeing the word force come up.
And when I'm seeing these words, I'm picturing what it looks like in my head. And I think everybody's picturing something similar, throwing. We're all picturing someone throwing something. So just some examples is what everybody was saying.
So yeah, hitting, kicking, biting, punching. And again, we can get even more specific, like hitting is defined as any time X does X, Y, and Z. But for the sake of this presentation, just getting a general idea of what aggression might be. So thinking about disruptive. So there were some things that came through the chat that I immediately thought of disruption versus aggression. So again, that's why it's important to clearly define. So when I say the word disruption or disruptive, what are some things that come to mind? And we can put those in the chat as well.
Interrupting, yelling.
Being loud. All right, so a lot of interruption, being loud. What about falling out of their chair? Falling out of your chair, maybe throwing things.
being loud in inappropriate times, that's very specific because I could be loud on the playground or I could be loud during a teacher's lesson. And also, we even defined it even further. For loud, we would say making words or noises above a typical speaking level. We really get specific. Taking over the atmosphere. All right.
So yeah, a lot of those words, those action words that came in: yelling, banging, slapping hand or fist on the table. Someone I think said tapping. Depending, again, Anna brings up a good point. Is it above conversational level, or is it at an appropriate time to be tapping? So she brought up the playground. It's appropriate to be loud on the playground, but might not be during Miss Natasha's lesson. So thinking about those types of things. And we call those examples and non-examples. All right, so we talked about the antecedent, the behavior, and now we're gonna talk about the consequence. So the word consequence often can be seen as a negative connotation. When you hear consequence, oh no. When we talk about consequence in ABA, it just is really what happens after the behavior. It could be good, it could be bad, meaning it could be reinforcing or it could be punishing. So thinking about the consequence, it's just what happens after the behavior, like what occurred. So what did I do? What did Anna do? What did the caregiver do? Those types of things. How did we respond? So thinking about challenging behaviors and knowing what we know about ABCs and ABA, challenging behaviors are learned over time. They are learned behavior. They're usually shaped up in the environment, and they do have clear, sometimes, but there is an antecedent and a consequence, which increases or decreases the likelihood of future occurrences. So when we think about challenging behaviors, there's a meme that's out there that that the behaviors, they are just what they are. They just occurred. They're learned over time because they have clear antecedents that occurred before the behavior, and they have clear consequences that are maintaining or shaping those behaviors.
I also wanted to add that in terms of learned over time and shaped by the environment, that doesn't mean that anybody was intentionally teaching a child an inappropriate behavior. If a child is hitting their head, a very natural response is to stop the child from hitting their head. As we observe the A, the B, the C, we will determine if stopping them is the right response. Maybe it's responding differently. Safety is always key, but the consequences will let us know how we should be responding in the future if we want to see improvement.
All right, so we are going to do a little breakout group. But before we do this, we have a handout, and this little reminder will be on the handout. But just again, the A is the antecedent, which is that trigger. So what occurs before the behavior? What is being triggered? B is the behavior, so it's that specific response, and C is the consequence.
Melissa, not that one. That's handout 2. Can you put handout 1 in? So you'll see the handout, you'll read some examples, and you will answer. Here, I'll put it on the slide.
Yeah.
There will be an example. You'll read it as a group, decide what the antecedent is, the behavior, and the consequence. Natasha, do you want to assign?
Yeah, I don't know. I think I can actually sign them. Oh, I can't assign rooms. Okay, so I'm going to put something in the chat box. Oh, that's not what I meant to do. Sorry, I don't want to do that. I need to recreate that. I want to hit enter there. All right, so I put something in the chat box. I'm going to randomly assign breakout groups. If you are assigned to room 1 and 6, you're going to do scenario 1. If you're assigned to room 2 and 7, you're going to do scenario 2. The scenarios are numbered on your sheet in the handout that Melissa put into the chat box. So here in a minute, I'm getting the chats created, room 10. So you're going to randomly be assigned. So just look for your room number, and then that's the scenario that you're going to do. So I'm not going to read off where everybody's going, but if you do have questions, just raise your hand or put it in the chat and we can answer. So I'm
Look at the examples, and then we'll give you about what, 6 minutes, Natasha, do you think?
yeah, because everybody will have one, so it shouldn't take too long, and then we'll come back and we'll review them as a group. It's just to kind of give you some time to chat amongst your peers and oh, are you referring to the scenarios?
Does everybody have the sheet? It's in the chat. If you click on it, you'll see it bigger.
Yeah, I think you have to actually take that before you go into the chat.
So if you click on it and open it up, it should pop up on your computer as a picture. And then you can see the 5 scenarios. Okay. I think they're good. I think send them in.
Yeah, I did. They're open. I see people
Okay.
going in there. Not everybody has, but
I started a timer for us.
okay. Holly, you're in room 1.
Sarah asked for help in room 5. I will go in there.
Okay.
I don't know how to get into my room. Does anyone know how to get me into my room? Because I'm not in a room.
Oh, Raquel. Okay, I was trying to figure out who's talking. I think if you don't catch it in time.
Sorry. That's Holly that's talking. Holly,
Yeah.
Holly can't find her room invitation.
Yeah, so it looks like Holly and Raquel, you guys are all in room 1, and I don't know how to resend room 1.
I don't know how to get in there. I can't find it.
Holly, do you see where it says more? It should potentially have. Oh, I'll send you
More.
there. I'm gonna send you. Oh, room 1 isn't listed.
Yeah, I can only send them to a different room. All right.
I don't know what happened to room 1.
It's there. There's people in it. You can't resend them if they're assigned to that room, you can't reassign them. You can
Oh,
reassign
I
them.
see. We can't send them there. It would reassign them. Gotcha.
Mhm. So I'm gonna move them to a different room because I just moved somebody out of their room that hasn't joined yet. So yeah, there's a few people still in the chat that haven't gone to their rooms. Holly, I'm moving you.
Okay, thanks.
Yep, you're in room 2, so you should have got a notification.
We finished up in ours.
Okay.
I think we were 7.
And we're going to go over the examples after. So if there could be one representative from each group to share their response, either vocally or in the chat when we go over that example.
Everybody back? No, not yet. Do you want everybody to come back?
I'm closing the room.
Okay.
Yeah. All right, we're just waiting for everybody to come on back. There's a few people that are still in their groups.
Our group had a hard time coming back into the meeting. Maybe the other people are having a hard time too.
I don't know.
We're missing like one whole group.
Missing like 7 people.
Yeah, and then there's a
I
few.
think you should be able to call them back to the room.
Yeah, I closed them. They should, it gives a countdown, so everybody should be back now. Like
Okay,
it automatically.
here they come.
Yep. All
It
right.
gives you the option to leave the meeting or
Oh,
leave the
room.
breakout room. So some people may have clicked leave the meeting and then didn't realize that they left.
Yeah.
So then they need to come back, log back in.
Yep, that could be. All right. Anna was saying something before we all broke out, that for each person in the group, we're gonna have, when it comes to your scenario, you can go ahead and put your answers into the chat box before we give the answer. I did have to shuffle some groups around just because some people are having a hard time getting in, but that shouldn't affect like our answers and whatnot. So first scenario. All right, so Ryan's mom places a turkey sandwich in front of him for lunch. He starts to yell and cry. His mother removes the sandwich and tells him to go to his room. So, so it looked like room 1 and 6 had this scenario. So somebody from one of those rooms want to tell us what the antecedent is?
The turkey sandwich?
All right, so Ryan's mom places a turkey sandwich. Yep, that would be the antecedent. So she puts the sandwich in front of him. Thanks for jumping on the mic, by the way. All right, so what would be the behavior in this case from groups 1 and 6?
Screams and yells.
All right, so screams and yells. Great. And then the consequence. So what happens after Ryan engages in that said behavior? What does his caregiver do?
Sends him to his room.
Great, sends him to his room. Perfect.
Anything else? Sandwich is removed.
Oh, yes, and the sandwich. There's 2 things in there. So,
I just wrote the one, but sandwich was removed is a
yeah,
key element.
yes. So there's 2 things there. Sent to his room and the sandwich was removed. Someone caught that, Christina. Nice
Very
catch.
good. Everybody's spot on.
All right. So in this scenario, anybody from group 2 or 7. So Jason is watching TV and his mother turns it off and says, "Do your homework." He begins to yell loudly. His baby sister is sleeping. So his mother says, "Fine, you have 10 more minutes," and then turns the TV back on. All right. So what is the antecedent here?
Mother turning off the TV and telling him to do his homework.
Right. So turning off the TV and telling him to do his homework. Might see that often. All right. So then, excuse me, the behavior here. What is Jason's behavior?
He yells loudly.
All right. So he's yelling loudly. And then the consequence for this. What is the consequence?
She turns the TV back on.
She turns the TV back on. Is there another one? And yep. And his homework was actually removed too.
Are all the groups putting their comments in the chat?
There's just 2 groups. I think that
Just
was,
2 groups? Okay. I wanted
yeah,
to make sure everybody's practicing.
yeah.
Okay, ready for the next one?
All
Natasha,
right. Sorry.
ready?
Yeah. Yep. So, groups 3 and 8, really anybody can answer too. You're right, Anna. It doesn't just have to be that group, but, so William and his mom get into the car to drive to school. William starts to flap his hands and rock back and forth. His mother puts on his favorite song. So what is the antecedent here? So getting in the car to drive to school. Yep. So, that would be the antecedent. And then what is the behavior here? So flapping and rocking. All right. Yep. So he's flapping and rocking. And then the consequence, what happens once? So mom puts on his favorite song. Great. So you guys starting to get the idea, like, okay, we have to identify the trigger. the behavior, and then what is happening after. All right, so we're going to move on to the next example or scenario. Sam is playing alone in her room. She sees her mother and sister playing. She starts to throw toys at them. Her mother looks at her and says, "We don't throw our toys. Come over here and play with your sister." All right, so for the group, what do we have? 4 and 9 have this scenario, or really. So what would the antecedent be here? So anybody from groups 4 or 9 playing alone, all right, and sees mom and sister. So yeah, the playing alone. All right, then what would be our behavior? So what does Sam do in this scenario? She throws toys. She throws toys at them, and then what is the consequence? So yeah, mom invited her to play. So twofold, she gave her that verbal, we don't throw our toys. So kind of like a reprimand or mom telling her, no, we don't do that, and then come over here and play. So it's kind of two things there. All right, last one. AJ is given scissors and paper and told to cut. He throws the scissors across the room. His teacher sends him to the principal and takes away the scissors for the rest of the week. The groups 5 and 10, what do we have here for the antecedent?
He's given the scissors and paper and told to cut.
All right, so he's given the scissors and paper and told to cut. And then the behavior here?
He throws them across the room.
All right, so he throws the scissors across the room, and then the consequence for his behavior?
There's 2 of them. He's sent to the principal's office, and the teacher takes the scissors away for the rest of the week.
All right. So
Yes, and the taking the scissors away is also a consequence.
yeah, so both of those. So sent to the principal and removing the scissors. So there can be multiple consequences. So you know, it's important to identify both or all consequences that are occurring, because one could be actually maintaining the behavior over the other. And that's what we want to kind of figure out. Is it the principal's office, or is it the taking away the item that's maintaining maybe that behavior if it keeps occurring? So it's important for us to really identify all maybe antecedents and all consequences so that we can really pinpoint what exactly is maintaining that behavior.
Yes, and that's why we added that info, because there's something that happens after. When looking at ABC data, one thing that maybe you could think of is like you're taking a picture. I'm taking a snapshot of what happened. So we want to look at like what happened right before, not like 5 minutes earlier. That might be important information. And we'll get into how you can record this information and take some data just so you can keep a log. And so you might state that, he was hungry and skipped his lunch. What happened right before the behavior, though, is that he was given scissors. The skipping lunch could be important to add, but we want to look at what happened immediately before and then immediately after, as well as some other things that occurred. Okay, thanks, Natasha. So Natasha touched on this a little bit in terms of what we would call as maintaining the behavior. So we believe in behavior analysis is that all behaviors serve a purpose. So we really see behaviors as a form of communication. Like we were saying before, there's no good behavior, there's no bad behavior. Sure, there's behaviors we'd like to see more of and ones we'd like to see less of. But as behavior analysts, we're always looking at behavior and seeing and trying to figure out what is the child trying to tell us. And this is a great, example that I think everybody can determine why this baby's crying. Well, the consequence, they got their bottle, so they were hungry. Young children oftentimes have a difficulty expressing their emotions, especially when they're upset. Children with ASD often have an even harder time and may sometimes emit behaviors that don't really seem to match the situation or are inappropriate. So I think, Natasha, you brought up an example of walking home and taking a different route, turning right instead of going straight. That could result in a child falling to the ground and screaming and crying. Not all children would respond that way. They might, but the child with autism is responding that way, and we want to know why. And Natasha, when you touched on it, there's a symptom of autism, which is rigidity. So, the person turning right changed the direction of where they were going. And it's through looking at the antecedents, behaviors, and consequences that we're going to figure out the purpose. There's no exact answer. It's not math, 1 + 1 = 2. It's science, so there's a hypothesis. So we're going to gather as much information as we can to make the best educated decision or guess at why the behavior is occurring. And so what we call that is the function. So the function is the why. And like I said, you'll be able to determine it or begin to be able to determine it looking at ABCs. Again, this is something that a whole week could be spent on learning about and practicing. So we're just going to give you some basic information about it. So in behavior analysis, we believe that there are certain functions and reasons. We believe that it's to escape, avoid, gain access to what someone wants, gain attention, or it's sensory or automatic. So sensory meaning like it feels good, or automatic could be it's just happening, like me shaking my leg, that could be automatic. This chart has been helpful. It's a lot, so let us know if you need more explanation. But when we look at behavior, the reason why it occurs is either to gain something, obtain something, or maintain something, or avoid or escape something. We might be wanting to gain things that feel good. So for sensory, things that feel good, maybe big squeezes feel good. Maybe being picked up feels good. Or in the area of sensory, we might want to avoid things that are maybe painful or uncomfortable. One child may love the squeezes. Another child, you approach them to touch them and they don't want to be touched. So they will engage in some type of behavior to let you know that. Then there's attention or social interactions. So, and it's across adults and peers. We might want to gain, obtain, or maintain positive interactions, praise, high fives. I want to get high fives. Maintain could be, you are tickling me. I want you to keep tickling me. Or we might want to avoid things, unpleasant interactions, reprimands, scolding. Also with peers, same thing, positive interactions. We might be wanting to gain laughing or compliments. We might want to avoid or escape unpleasant interactions. Another thing to keep in mind, and we will go through this, even though we've separated the gain, obtain, maintain into the green, the avoid, escape into the red, reprimands and scolding, that's still a social interaction. So we want to keep that in mind when we're looking at what the antecedent was and then what the consequence was to a behavior. And we'll practice this. And then lastly, tangible items, my teddy bear, my train, my computer or iPad, or an activity, playing basketball outside, activity of playing video games. So we either want to gain or maintain access to those, or we might want to avoid something. So an activity could be being told to cut at school. We don't want to do it. So we might avoid. Something that you personally might think is something you might want to gain, obtain, or maintain doesn't mean that for every single person. Some people like certain things and other people don't. So why we're looking at the function and the why is because we really want to get at the root of what's happening and not just what we assume, what our assumptions are based on our own experiences. Some examples again, oh, we went over some of these. I don't think we need to go over it again. So let's see. Natasha, this is another breakout group, correct?
Yep.
Is this one?
Yep.
It is? Okay.
That's the 3.
Melissa, somebody lost connection. Could you put the pictures?
Yes.
Thank
I'm
you.
on it. Let me find the chat.
All right, so again, we're gonna do what we did before, as far as we're gonna randomly assign you breakout groups. So I'll give you a heads up. Last time I just put it out there into the world. I'll give you a heads up when I hit the button. When I hit a button, something will pop up on your screen that will allow you to like get access to be admitted. So it's similar groupings. So here are the groupings. Just put them in the chat. So if you want to screenshot that, or can't remember if this stays up as the groups pop up, but anybody in 1, 3, 5, and 7, you'll do the example 1 that's in the handout that Melissa attached. 2, 4, and 6, you'll do example 2 in the handout, and then rooms 9, 8, and 10, you'll do it in the handout, in the first handout with that looks like this slide. So that's the handout that you want to use because there's only 3 examples in that slide.
And it'll
So
say the example up at the top.
yeah.
And
Go
what
ahead.
you're doing is you're reading it, looking at the antecedent behavior and consequences that we've already as a group decided. And based on those, what do you think the reason that the child engaged in the behavior for? And we're all learning, so, there is a specific answer, but practicing does just make you better at it. So don't be afraid.
All right, so I'm recreating the groups now. I'm about to hit open all rooms. So once I hit that, something will pop up on your screen and you'll just click to admit yourself into that room. And then again, I put in the chat box. If you're assigned to room 1, you're doing example 1. If you're assigned to room 2, you're doing example 2, and so forth. So all of them are in there. Again, if you have any questions, feel free to ask. All right, hitting the button now. All right, hold on 1 second, Sarah. Moved you to a different room because I can't move you back to that room. So I put you in a different room. All right, so I think some of us have returned to the main room. I have given the minute warning to the other rooms that the breakout rooms will be closing in 45 seconds and counting. So once everyone gets back, the same thing. We're going to go over the examples, and then people from their designated groups can either jump on the mic or put their comments in the chat box. Gotta pull up these groups. Remember. All right, 16 seconds. I'm just gonna put the groups back in the chat so I can see them again. I forgot how to pin things in there. All right, I think we're 2 seconds. Pin that.
Is everyone back?
I think so. Yep, we're all back.
Okay. Because this is the beef, the meat of what we're talking about, we want everyone responding. So rather than putting it in your chat, we'd love if one representative from every single group shouted out an answer. You might talk over each other, but I think we'll get the idea of what everybody is thinking. Okay, so example 1. William and his mom get in the car, drive to school. He starts to flap his hands, rock back and forth. His mother puts on his favorite song. So we know the antecedent in the car, flapping hands, consequence, favorite song is put on. What do we think the function is? Why is he doing this?
We said
It's really impossible to know, I think.
we said he probably wants some attention, but that's not necessarily a bad thing. You know,
Right.
maybe he
So
missed his mom, during the day or something.
It could be he doesn't want to go to school. It could be he's excited to go to school. It could be he saw something outside that made him happy. He could say something that made him sad or mad, and she just knows that that song is comforting to him.
Right. His rocking back and forth might be he's nervous. And so she put it on because he was nervous and his favorite song would calm him down. So yeah, there's a lot of different ways. I think that was wise too. There's a lot of different reasons. I think it could be he's getting what he wants. So if he flaps, maybe his mom doesn't like when he flaps and he knows if he's flapping and she puts a song on that he'll stop. So that would be, yeah, I think you could probably put a lot of these different pieces in there without the full thing.
And just one comment to remember that none of these are considered good or bad. We're just observing it happening as if we just saw a picture and we just want to pinpoint from what we saw, why do we think it happened? But those are all great responses. It's to get what he wants. That's what we've hypothesized in this example. Because when he's flapping his hands, the immediate thing was putting the song on. Now, also just a side note, because I know everybody is saying that there could be other reasons, and there totally could be. When we are determining what the function is, what we think the function is, we're not doing it off of one example. We're observing behaviors for hours and days at a time. We're watching the behavior happen constantly. And we're recording what happened first, what happened next. And it's through getting all that information and all of those examples, we make the best guess as to why it's happening. Okay. The next one. So this is when Jason and his mom, she turned off the TV, told him to do homework. Groups 2, 4, and 6. What do you think the function is?
We thought it could be a couple, but definitely to get what he wants was probably the initial function.
Also avoidance and escape.
Okay.
Could be both to get the TV and to get out of homework.
Yes, everybody is correct. And so it can be more than one function. Based on this information, multiple things happen in life. But the one thing, or the things that we know, is the TV went off, the behavior happened, the TV went back on. So that's why we look at it as escape avoidance, for getting what he wants. Oh, I'm sorry, the escape avoidance, that's to get what he wants, the TV. The escape avoidance is, I was told to do homework, I did this thing, I didn't have to do homework anymore. And also I feel like this example really shows that point that I was making earlier, that behaviors aren't shaped intentionally or on purpose. Here it says that the baby sister is sleeping. So it makes sense that the mother tried to quiet him. Through looking at more of these examples, if we were working with this family, we would try to figure out ways that we could maybe change things to make the behavior less likely to happen. And then example 3, rooms 9, 8, and 10. Shout it out.
He's probably escaping, avoiding, he doesn't want to cut, maybe.
Anyone else?
That was the same thing I thought. He was avoiding the cutting.
Or scared, like he's used them before and gotten hurt. So he's like, get these away from me.
Okay. Yes, everybody is correct. Escape avoidance. This is actually a real life example of a child that I had that transitioned into a, he was in a ABA classroom, transitioned into the general educational setting, and he had really poor fine motor skills. And cutting was really hard. Writing was really hard. We worked on it a lot and really systematically. He got lots of support. Now he was in a classroom of 25 kids and given this like intricate picture that he had to cut. It wasn't the first time he's ever thrown anything, but he threw the scissors. And when I went to go, I wasn't there when it happened. When I went to go visit, they said, oh, well, he's not using scissors for the rest of the year. And it wasn't clear to them that by doing that, they could potentially be reinforcing throwing scissors, because we've taught him that when you do this, that thing that you don't like, it disappears. So that's why we really want to look at what the function is. All right. All right, so we're going to do an example together.
Oh, Anna, can I say something really quick about
Yeah.
the last one? It took me a minute. I was like, so also, Anna brings up a good point about a skill deficit. So we also want to make sure that, you know, along with, we want to find the function, but we also, it could also be a detriment to our clients and our children or nieces, nephews, whomever, if we're not teaching them the appropriate skills, because now, you know, we might be, again, shaping up that all I have to do is throw scissors. So now he's might never be exposed. So we're almost doing more harm in a way when we're looking at, you know, not giving him or them the skill that they need. So that's also one thing that we have to like keep in mind too, when we're looking at behavior and the bigger picture.
Yeah, and I think also to reframe the situation, the teacher took the scissors away. That makes sense, right? Throwing scissors in a class of 25 children isn't the safest thing to do. So the response makes sense. But that's when someone like Natasha or I would go into the classroom and again, just watch multiple instances of behaviors occurring and looking to see what happened every time before he threw and what happened every time after he threw. And then that will give us the information. And like Natasha said, then we can form plans where we work to maybe give him more skills. We work on the response after. So maybe we want to make the situation safe, or we definitely want to make this situation safe. So we remove the scissors for now, but maybe he has to cut later in a more controlled situation. But again, that's why the disclaimer was given. This could be much lengthier and it's all individualized per student. Our goal is to get everybody's minds working in the way of seeing function. Why is something happening? So we're going to do this example. Okay.
It was hard to hear some of that, Anna.
Oh, was it? Okay.
Yeah,
Well,
I
most
could
of it was
see.
really visual.
Yeah, it was
Um,
visual. I could see.
Actually, I think the only words that were used were he did something to my shoulder.
Yeah.
Okay. Okay, so if a few people could just like throw in some ideas of what you think the antecedent could be. And you could shout them, you could put them in the chat.
I think maybe he was ignored.
Okay. Playing toys. Okay.
Maybe his root was blocked.
Okay. Felt left out. Okay, attention. Okay. So the antecedent is the event that occurred right before he had a behavior. So when we first started watching, he was playing alone and he saw other kids playing. What did he do? What was the behavior?
There should be one that's open.
I'm sorry? So if some people can put in the chat what they think the behavior was in the video, there's definitely something there that we would like to see less of. Tongue out, then scratch. Hitting. Right. He blew a raspberry, he hit, he scratched. So right now we know that he was alone. He saw a group of kids playing together. He went over, he blew a raspberry, he hit a friend, and he scratched him. And then what was the consequence? Excellent. So, oops, there we go. The peer looked at him and yells and hits. So with that info, what do we think the function of the behavior is? We have our A, we have our B, we have our C. Yes, everybody spot on. The A, B, C told us that likely this was attention seeking. I'm not going to go in depth with this because we're going to talk about it when we talk about strategies, but something that Natasha brought up. The function could be the function is that he wanted attention. Looks like he doesn't really know how to go about getting it appropriately. So there's some things that might need to be taught there. And he got attention from his friend. It was yelling. I might not like someone yelling back at me, but to a child or anybody who's playing alone, they might not mind that it's yelling. All they know is he's looking at me, he's saying something to me. So we also want to keep that in mind. Okay, well, hopefully you guys can hear this one. If not, I can narrate it.
Brownie.
Maybe ask for a brownie.
All right, it's lunchtime. But why? Because it's lunchtime. It's not time for brownies. I said it's not time for brownies. Right, you can have one brownie. That's it.
Okay, so watching this, what would everybody say they think the antecedent is? Remember, it's what happened right before. It was an action, something that that happened. Okay. Okay. So a lot of people are saying Brownie asked for brownies. Yes, he went over.
Brownie.
He asked his mom for brownies and she said no. So he said, "Can I have brownies?" She said no. And then immediately after her saying no, he had a behavior. What was the behavior? There are a few. Right. Okay. So I love some of the answers here. Stomp, jump, yell. Those are all things that I can visualize. If I wasn't watching this video and you told me that he yelled and stomped, I can imagine it. Maybe he's upset, maybe not. Maybe he just really wants brownies. We don't know how he's feeling. And, that's something that can be explored outside of this situation. But for right now, we're looking at just what the behavior was and what happened before it. Okay, and the consequence. Yes, and shoves brownies at her, shoves them and keeps asking. Great answers. Oops. Okay, what is the consequence? Yes, he got his brownie. Okay. So with this information, so he got the brownie. That's exactly what happened. We saw it happen. She handed it to him. Some people I think are putting what the function is as the consequence. The consequence is just what we saw happen. But based off of these 4 labels, what do we think the function was? Good. Yes, it's to get what he wants. He asked for something. She said no. He had a behavior. He got it. Over time, he may learn that's all I have to do. If I'm told no, I can just stomp my feet and scream. Mom doesn't want to have to deal with it, so she gives me what I want. Again, sometimes that makes a lot of sense given a situation. And as behavior analysts, our job is to just view it through the lens of the function. All righty. This is just to show you, no, we don't have to do anything with it, but this is an example of what we call a data sheet. It's our ABC data sheet. And we use this, we go into a classroom, we go into a house. Somebody's reached out to us and said, we're experiencing this challenging behavior. It looks like X, Y, and Z. We're going to watch it. So we're going to write the date. Don't worry about that part. We'll write the setting. Maybe it was the house, the activity. Maybe they were playing with cars. Who was involved? The brother. And we're going to watch what happens right before the behavior. So let's say the behavior's hitting. We're paying attention to what happens before he hits and then what happens after. And we're recording it every single time it happens. And we're choosing, this is, I think, important, just a few behaviors. We're not choosing every single thing the child's doing. We're choosing what's the most interfering behavior. And what you all just did was you recorded ABC data through your activities. This would be recording it here, recording every single one and making a hypothesis as to what the function is. Okay, responding to behavior. So now, with this knowledge as to why we think a behavior is happening, how do we respond to them? It's either what we do before they happen or after they happen. So responding to behaviors, an effective response is always preventative, focused on the prevention of future occurrences. Sorry, it's not always the most effective response, but it's a very effective response, that we want to make sure this behavior doesn't happen again, or we want to reduce the likelihood that it could happen again. We want to make it instructional. So we want to teach what the expected behavior is. Like, what should the child do instead? So that when it comes up in the future, what should they do? So instructional, the child who hit his peer because he wanted to play, we could teach him, let's go up to your friend and tap him on the shoulder and say, can I play with you? Let's practice that over and over again, so that when you do that, you tap, the consequence that you receive is perhaps a child plays with you. It's a much, it's a behavior that would get a much better response than the hitting. And then also that it's function-based. We want to make sure that whatever we're doing doesn't reinforce the problem behavior. Give the behavior what it wants, not the person, but the behavior, and helps the child learn an appropriate way to get their needs met. So again, the example of cutting. We want to maintain safety in the classroom, of course, but we don't want to take away scissors for the whole year because we're just teaching him to throw. Or we don't want to take away scissors for the day because he's learning he doesn't have to cut. We want to try to help him get his needs met. Maybe he asks for a break. Maybe he says, you know what, my hands are tired, I want to cut this later. Or maybe a teacher reduces the amount that he has to cut because it's something that's challenging for him. These are all the ways that we're going to respond. So there's prevention strategies. We said that we want to prevent it from happening, prevent the behavior from happening or from escalating. All parents implement prevention strategies at home. Some examples: toddler gate on the stairs. That's a prevention strategy from your child falling. Locking cabinet under the sink. That prevents your child from touching toxic materials. Another prevention strategy is sometimes parents might avoid parties or dinners if their child cries when you take them. Another example is if you turn on a vacuum and your child covers his ears and starts to cry, the next time you go to vacuum, you might make sure that he's playing outside or he's in a different room before you turn on that vacuum. Okay, so altering the environment, this is one strategy. We're going to go over now just a few basic prevention strategies and what they look like. So altering the environment, it changes the setup so that the child is successful. If you look at this picture, it looks like a mess, right? The child's expected to do his homework. Doesn't look too conducive to getting your homework done. So a intervention where you alter the environment could be, I move everything off the desk. I have a clear workspace so that he's more likely to do his homework. Another one, sitting in between two children who often fight over toys. So maybe in that classroom where the child crawled over and hit his friend, maybe a teacher sitting close by so that when she sees it happening or about to happen, she can jump in and say, hey, remember, you can ask him if you want to play. Giving children a bath separately if they fight in the tub, getting dressed for school before going to play. I really want to play. I really don't want to get dressed. Let's get dressed first then. Another one, putting treats out of sight so your child can't see them. We're not going to leave like M&Ms all over the table if every time we say no, they cry. Another strategy that we do a lot of is called priming, and it's preparing the child in advance. We want to make sure they're successful, so we prime them for the situation. Priming can help during transitions to places or away from things. Like, we're about to go to the doctor's office. Let's talk about how you can be prepared for it. Changes in schedule, routine, new situations. We're going to go to your cousin's bar mitzvah. This is what it's going to look like. It's going to be in a synagogue. These are the things you're going to see. Starting a task, preparing for an upcoming event, and reminding them to use their coping skills. So an example of the child who hit his friend, priming could be, hey, we're about to go play. Remember, if you want to play with your friends, you can walk over to them, tap them, and say, can I play? You just want to remind them that there are some skills that they have that they can access when they need it. Here is just a quick example of priming.
In 1 minute, we're going to start doing our work, okay? We're going to have to stop using our iPad, okay? So I'm going to start the timer now. Look, here we go.
Let me fast forward a little bit. He just talks to her a lot while she's playing.
Is that a rose? Oh, very nice. All right, Janelle, you got 15 seconds. Oh, look, 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. All right, time's up. Good job, Janelle.
So he told her ahead of time, this is how long you have for your iPad. So she knew when she went into play that she only had a set amount of time.
In 1 minute.
Another strategy that we use is called first then. And it's as simple as it sounds. It's a statement that we use to increase motivation in completing something that you don't want to do. So the example that I used, I don't want to get dressed, but I want to play. Okay, first let's get dressed, then you can play. You want to identify what's motivating. It's often really effective with all children, with individuals on the spectrum of all ages, it's effective. This is very, very effective with toddlers, preschool students, kindergarten students. Visuals help everybody. The visual makes the first then statement. It shows the picture. And then only access is provided after they do the item that was first. We aren't going to get our snack until we do circle time. Okay, I'm going to go through a little quicker. Providing choices. Providing choices offers some shared control to increase motivation. Children have decisions made for them all day. If we can give them a little bit of independence where they can choose, they might follow our directions a little bit more. So we could say, do you want to color your picture with crayons or markers? We're still coloring our picture, but I'm giving you the choice of crayon or markers. Let's do your homework. Do you want to do math or reading first? Okay. I'm going to zoom through. You'll all get the slides because we only have a few minutes left. Oh, you know what? I think we need to end. But you'll get the slides and a lot of them will have the detailed information in them. I think we should probably open it up for some questions now. Let's see.
Would you like me to start out with some of the questions that came in the chat?
Sure.
Sorry, there was one near the beginning that I want to go back to. Oh, regarding genetics, do you know if it's genetic from mom's side or dad's side?
So the research isn't like, they do know that it's with age actually, not so much like male, female. There has been some research out there that suggests it's with age, and the older the male is, the more likely that they are a carrier. There's still research going on, but some of the research does suggest that it is older age in general. But if you happen to have two parents and the male happens to be older, they're seeing some of that, but it's still up in the air with a definitive answer.
And another question from the chat. Is there a reliable diagnostic test that an older child could take to talk with a doctor about?
There are, forgetting the name of it now, but we can throw that in the resources as well. Write that down. Well, there's the ADOS that that Natasha had mentioned, but that is administered by a professional. So you would go to your doctor and talk to your doctor about your concerns, and they would help you set up the administration of that test. But there are questionnaires that you as the parent or the caregiver can fill out to get a sense of is something going on.
So Sarah, you might just unmute and help us understand your question a little bit more. It looks like you're asking about a platform that offers support for parents dealing with these kind of behaviors and oversight from a professional.
Yes, my question is there a platform out there that's kind of monitored by some professionals that would be able to give recommendations for certain types of behaviors that are observed by the parent and maybe shared amongst other people so that they could use some of the resources given, such as like suggestions that maybe the person who has the qualifications for it would be able to give recommendations, or even maybe some input from parents that have dealt with that same kind of behavior and what has worked and what has not.
So there are groups for parents of children with ASD. I'm not familiar with any groups for children who don't have ASD, but I think there's a lot of like if your child does have ASD, there's Autism Speaks. You can find groups there. I know a lot of parents go on Facebook actually, and you know, you have to monitor or weed out, you know, if it's a good group or a bad group, but there's lots of groups that families that I work with go on just to find out more information. Like my kid's going to public school, what's it like? What are the special ed services like? And the families share. Or I'm struggling with this type of behavior. What kind of therapy did you get? Or did you get therapy?
I think to answer, yeah, the other part about the professional piece being in that group, since treatment is so subjective, it would be unethical almost for us to offer those services in a parent group like that. So you wouldn't find us necessarily in a group.
Or you wouldn't find professionals. It would be parents who are in your same situation that could maybe refer what they're familiar with, because Natasha and I aren't familiar with it.
Okay.
But if you have any concerns, you can always talk to your, you know, your doctor about what you're seeing, and they might have some resources, or call your insurance company and see, you know, if I want to get some services for my child, how do I go about that? Do we have to have a diagnosis? Do we not? Sorry, go ahead.
Okay. What kinds of resources are available for kids diagnosed later as teenagers or even young adults?
What do you mean by resources? Like diagnosing, school strategies? Do you
So
want to
like
unmute,
treatment
Heather?
support, things like that.
I'm sorry, can you repeat that?
Sorry, my voice is terrible because I'm getting over the flu, but things like what kind of treatments and stuff do they do for kids? I know there's a lot of focus on like early intervention when they're diagnosed really little, but what about when they're older or even as an adult and they're just getting diagnosed? What does treatment look like then?
I could take that in.
What?
I said I could take that if you
Okay.
want. So it's not gonna be any different, but the focus might be more so on that social piece. It's really gonna depend on the individual's functioning level. So it might not differ than early intervention depending on the individual. But if it is somebody that is able to maybe join a social skills group and work on some of that, or maybe to go and do some things like in a day hab or community center, or maybe even hold a job. So it really is going to range. So it could be very similar to early intervention, or it could be very different, depending on the skill set and like what, because there are very high, like I don't want to say high functioning, but there are individuals that don't get diagnosed until later in life because it might be maybe a slight social deficit, or it might be some other like anxiety behavior that has limited them, but they've been able to kind of go throughout life, but now they're seeing it starting to impede. So that's kind of that varies in a little bit versus that early intervention piece.
And the process would be the same. You would look for signs that you're seeing, go to your doctor, get diagnosed. Once you're diagnosed, then that's where you're deciding, am I getting services through insurance, through education, like a more specialized program like Natasha mentioned, and it's all individualized for the child. So do they need to work on educational skills? The place that you find the services would do that. Do they need to work on like daily living skills, like getting dressed by yourself? That would be worked on. And also it would be just different treatments. It could be ABA, it could be floor time. There's other treatments out there. I would go on to CDC, which we're linking, or Autism Speaks to find information about that.
Okay, thank you so much.
Okay, guys, that was amazing and a ton of information. And I really think that you covered everything that we wanted you to cover. So great job. Thank you so much. I will get you guys the resources from Anna and Natasha. And if you do have questions for them, you can feel free to ask me and I can ask them questions as well and get back to you.
Absolutely.
Yeah, but you guys can go. We are going to take attendance and do a survey, and I will send you the results of the survey. So you
Wait. Doesn't Dawn want to give the door prizes?
I'm just letting Anna and Natasha go.
Oh, don't Anna and Natasha want to hear who wins the door prizes?
You know
Sorry, you guys.
They're reinforcement.
Sure, if you guys want to stay on for that, you can.
You just said you guys, which could have been everybody.
But I wanted to do the survey first, Raquel.
Okay.
So you guys can go and we'll do our admin stuff. And thank you so very, very much. You guys were wonderful.
Thanks, everyone. Bye.
Thank you.
All right, I'm going to post the survey in the chat. We're going to do that for about 2 minutes and then we'll do door prizes and we have attendance. So we'll just be letting you guys go after that. Give me 1 second. All right, there's your survey. I'll give you 1 more minute. Sarah, take the survey, see the link that says shout.com, click on that, and that's what we're doing right now. All right, Raquel, you are up.
Dawn is up.
Right,
Dawn, the door prizes.
I'm up. So for door prizes tonight, we have Jeff, and I'm not sure if I'm going to pronounce your last name right. Jeff Laib, is that right? Sarah Xiong and Christina Ashley.
All right, great. So look in your email for an Amazon gift card. It may go to your spam, but it will be sent out tomorrow or the next day. You guys are good to go. Thank you so much. Thanks for coming.